Doctors have been feeling the effects of the national drug shortage with some life-saving drugs that are hard to come by. Southern Nevada doctors are worried in some cases it could mean life or death. 8 News Now reporter Victoria Saha tells how oncologists and patients are navigating this difficult time.
Cancer, the C word no one ever wants to hear.
It's scary because the first thing you think of is, well, how much time do I have left?
43-year-old Eric Tope is battling stage 4 colorectal cancer. I spoke with him as he was getting chemotherapy Tuesday.
So none of us like to come in here and do these treatments, but it saves our lives.
It's a life-saving drug that Tope now has to be on the waiting list for because of a national shortage. Normally, these chemotherapy drugs are delivered every 2 days, but now there's a 3 to 4 week wait, which means delaying treatment for patients.
It's a scary thought that you can't have that access to that drug.
Sometimes we may have to delay our treatment. Never in this country would I thought we would have to ration chemotherapy drugs.
While patients of Dr. Rupesh Parikh are battling cancer, he is left with a different battle, now figuring out who can get the drugs that are available.
Well, we pick and choose by level of severity. We pick and choose by the disease state, but sometimes there's not a right answer.
What's the response that you get?
Surprise, shock, anger sometimes.
He says they try to order enough of the chemo drugs, but some of the companies that make them aren't making enough or dealing with a low profit margin.
If there's nobody making these drugs, then what do we do? Right? Do we go to drugs that are more toxic? Potentially, that we may have to do that.
As for the many patients like Tope, the future is unknown.
We're all trying to fight. You have to accept what the outcomes could possibly be.